Hello, I'm Senator Ted Lieu, and I'm here to raise awareness of the incredible dangers of indoor tanning beds. The House of Medicine has come out and conclusively demonstrated that indoor tanning beds cause skin cancer. In 2009, the World Health Organization elevated tanning beds to a level 1 carcinogen, which is the same level as plutonium in cigarettes. Both the FDA and the U.S. Department of Health and Human Services talk about how severely carcinogenic these tanning beds are, and that's why I have introduced a bill that is sponsored both by the California Society of Dermatology and AIM at Melanoma that bans tanning beds for anyone under 18. One reason is because the medical evidence also shows that the damage to your skin is cumulative. So the more exposure to tanning beds you have earlier in life, the worse it will be for you later in life. And right now, it is a rising epidemic. Skin cancer is a leading cause of cancer death for anyone between 25 and 29. And what people don't know is there is an incredibly safe alternative to tanning beds, and that's spray tanning. Many of these salons have spray tanning. You get basically the same exact result. And I'm a little disturbed, I know this following fact, but Snooki on Jersey Shore has switched to spray tanning. I don't want to say I should watch that show, but I do know that fact. And so a lot of celebrities have also switched to spray tanning. We're just trying to get people between the age of 15 and 17 to do this same thing. Now, many states have already recognized the dangers of indoor tanning, and that's why California already has a ban. We don't allow anyone under 14 to go get a tan in a tanning bed. But a 13-year-old right now could go get a spray tan. All we're doing with this bill is extending it to all minors under 18 for the same reason that we don't let parents consent to have their children go buy a pack of cigarettes or drink vodka. So it is a simple, straightforward bill. California would be the first state in the nation to have an under 18 ban. We'll follow what what countries such as England and France have already done. In Brazil, they actually banned tanning beds completely. You can't even do it no matter what age you are. And in the United States right now, interestingly, the most progressive state on this issue, which some folks always want to compare us to, is Texas. They ban tanning for anyone 16 and a half and under. Would love to have some witnesses come up here and talk to you about the dangers of indoor tanning. And first, we have Dr. Seema Turabian, who is a dermatologist at Kaiser Permanente.
Good morning. My name is Seema Turabian, and I'm a board-certified dermatologist. Today, I represent the California Society of Dermatology and Dermatological Surgery. It is my honor to join Senator Lieu to support this bill. I feel very passionately about this bill. Every day in my practice, I see many young patients, especially women, who are diagnosed with skin cancer. And many of them have history of either sun tanning or tanning bed use. What really strikes my memory is a patient of mine who was 21 years old, very young, beautiful female who had very potentials in her life. I diagnosed her with melanoma about a year ago. Unfortunately, despite having extensive painful surgery and chemotherapy, she died 6 months after her diagnosis. I will never forget her tearful and very scared face after I told her about her poor prognosis, and for her to beg from me if there were any alternatives to save her life. Every day, I have to make phone calls, explaining to patients about their diagnosis of melanoma or other skin cancers and how this will impact their life. And trust me that every time I want to pick up that phone, I have to give myself a few minutes and get myself together before I make that phone call to that patient. On average, in America, about 1 million people use tanning beds. 71% of those patients are between the age 16 to 29 years old. When you look at patients in teenager, about 12% of them report that in the previous year, they have used tanning beds at least once. And many of them are actually regular users of tanning beds. Ultraviolet radiation exposure, either from sun or tanning beds, is actually a main cause of skin cancer. There are many studies that support this. Many studies also show that ultraviolet radiation is from the tanning bed is 10 to 12 times stronger than the sun that you would get in the midday. And they look at this in Washington, D.C. So the tanning beds are actually very dangerous, and they are very much associated with development of skin cancer, in particular melanoma. Not only that, it's actually the exposure in the child or adolescent that is very much associated with developmental melanoma. In July 2009, as Senator Lieu mentioned, the World Health Organization went ahead and actually increased the level of the risk associated with tanning beds as a carcinogen. Many countries, such as Brazil, Austria, United Kingdom, and France, have either banned fully or restricted the use of the tanning beds. In the United States, there are 32 states that have some laws regarding restrictions of tanning beds. However, these laws are not moderated very well, and they're not enforced very well. Therefore, there is a high variability in the enforcement of these laws. The American Academy of Dermatology, the American Medical Association, the World Health Organization, and the American Academy of Pediatrics all support this bill in banning tanning for young minors less than 18 years old. I would really like to, on behalf of all the dermatologists, to really commend Senator Lieu for his support of this bill and in his effort to save our young population. We also ask you, the media, to please support this bill and also help us increase awareness in the population, both parents and consumers, about the dangers of tanning beds. Thank you very much.
Thank you very much. And after our next witness, we'll play a short 30-second DVD and then answer any questions. And I'm honored to have here Lisa Andrews, who will talk to you about her story.
Hello, my name is Lisa Andrews. I am a 6-year melanoma survivor. I'm one of the lucky ones. I first heard about indoor tanning when I was about 16 years old. I saw the cheerleaders at a football game donning their beautiful tans, touting the benefits of indoor tanning, telling me that since indoor tanning only provides you with exposure to UVA rays, it is much safer than actually laying out in the sun. I thought, what a great idea. And that's how my indoor tanning habit started at such a young age. I probably used indoor tanning anywhere from 1 to 3 times a week, especially during the winter months, from the time I was 16 into my early 20s. Unfortunately, at the age of 35, just a few months after my first daughter was born, I got that phone call that the doctor was speaking about and heard those devastating words that I had been diagnosed with a malignant melanoma. My knees buckled. I was nursing my young baby, looking in her face, wondering if I would be around to even see her grow up. It was one of the scariest things I had ever experienced. Thankfully, I was a stage 1, and I only had to endure a wide margin excision surgery and a few weeks of recovery. I feel so fortunate to be alive every day, but I still constantly live with the fear of recurrence. And I'm still paying the price every day for those foolish decisions that I made as a teenager because of misleading myths that are still so prevalent today. And my parents were misinformed also. They knew what I was doing. And even if there had been a waiver for them to sign, they probably would have signed it because they were under the impression that this was a healthy alternative to sunbathing for their daughter. And they were diligent guardians of my health. They would have never allowed me to do something that they thought was unhealthy or dangerous. So I strongly support passing a bill that would ban indoor tanning for minors 18 years of age and under. It's up to us to protect our children. I'm a school teacher, I'm an advocate for children, I'm a mother, and I urge you to pass this bill. And thank you very much for your efforts.
And let me just highlight what the two witnesses have said. One thing that came across is indoor tanning beds are far more dangerous than if a person just went and sunbathed because of the 10 to 12 times intensity of the UV rays. And in fact, just having 10 indoor tanning sessions will increase your chance of melanoma by 4 times. And so with that, we're going to play a short DVD.
My Jamie, a precious baby girl. When Jamie was a teenager, she would spend her lunch hours going to the tanning salons. I didn't realize how dangerous they were. If you tan when you're young, your risk for melanoma are increased by 75%. That's huge. No mother should have to visit their daughter in a cemetery.
This message is brought to you by the American Academy of Dermatology.
Any questions?
tanning salons that don't adhere to, if this passes, the law?
So we would hope that the tanning salons follow the law. This bill itself doesn't specify what kind of penalties they would have. If it turns out they're actually not following the law, then I would follow up with another bill that does have strong penalties in it. But I do expect businesses to follow the law.
And could you maybe describe I know in your release you were talking about the growing prevalence of these tanning salons?
Yes. So if you look at how many tanning salons there are, in many cities there are more tanning salons than McDonald's or Starbucks, including in Sacramento and in Los Angeles. And there is a great website called indoortanningreport.com, and that's in your press packets. But it'll show you a report that documents that. You can click on it, click on your own city, and it'll show you how many tanning beds there are and how many Starbucks there are. The report also shows that parental consent laws currently are not working. And they're not working for 3 reasons. One is sometimes the teens just forge the signature. Sometimes the tanning salons don't care about getting their actual consent form. And many times parents have no idea what they're signing because, as Lisa had said, a lot of times parents are just misinformed. They think somehow that tanning beds are safe, which they are not, or that they're a good alternative to sunbathing, which they are not. And so what we're trying to do is to really take the law to where it should be, where the evidence takes us, which is this really should be banned for minors under 18. We have the sponsors here of the bill who can answer any questions, as well as the American Cancer Society. And this bill is also supported as well by health insurers like Blue Cross and Kaiser Permanente, who understand how much this is costing our healthcare system. Thank you for being here, and we'll be here to answer any other questions.